So here you are watching intracapsular tonsillectomy in a 2.5-year-old child. You can see the tonsils are really huge. Adenoids are also very large. So we are performing both tonsil adenoid surgery, but it's an intracapsular surgery. I am using Coblation plasma wand at a setting of 9 for ablation and 4 for coagulation. So our aim is to reduce the bulk of the tonsil and the adenoid both. Adenoid will remove completely, but the aim is to reduce the bulk of the tonsil so that the child can breathe. He is totally breathless in the nights and is not gaining weight. So his weight is only 13 kgs and there is no weight gain for the last 6 months or so. So because he is unable to breathe, so you can see that at a setting of 9, we are ablating the tonsil tissue without any blood, without any bleeding, and we will stop when we have done more than 90% of the reduction and we have seen the tonsillar fossa. So right now I am only reducing the bulk of the adenoid of the tonsil, and I have not seen the muscles. I would not like to expose the muscles because in that case the uh, child will have pain while swallowing, and if he does not swallow then he will get dehydrated. So obviously we will not want that, and our aim is anyways only to reduce the bulk. Our aim is not to perform a complete tonsillectomy here, and you can see within a few minutes how much of the tonsil tissue is actually reduced. So we'll try to prevent any injury to the pillars or the tonsillar fossa. Now you can see within a few minutes the bulk of the tonsils is gone. Now I will do the final bit. I will not expose the muscles, but I'll remove as much of lymphoid tissues without exposing the muscles as possible. And obviously this is the lower pole, so I'll not go till the muscles, so I'll not expose the tonsillar artery as well, and the child will have a absolutely peaceful breathing in the night after his adenoid removal and tonsillar reduction surgery is over. So now if I leave too much of tonsil tissue behind, then there's a chance of regrowth. So I am going now doing the finer actually work, going closer to the muscle but without exposing the muscles of the tonsillar fossa. And remaining of the tonsil, whatever is remaining there, is the normal lymphoid tissue of the oral cavity, and that will keep on doing its job. And this surgery is not going to be painful because we have not exposed the musculature. We have only debulked the tonsillar tissue, and we have to be very careful while doing the surgery near the tonsillar pillars because that's where it is possible to injure the tonsillar pillars, which we'll try not to. And if there is a little bit of lymphoid tissue left, it's absolutely fine because it will keep on doing its job of immune regulation, and we are absolutely fine with that. So there's just a little more tissue which I want to ablate, and that's the tonsillotomy or intracapsular tonsillectomy on the left hand side in a 2.5-year-old child. At this age, it's not advisable to perform a complete tonsillectomy because then you expose the muscles. It can be painful. There's a chance of bleeding, and in a very small child, there's no reserve. So whatever tissue is left, I'm coagulating now. So hopefully this tissue will stop reacting and it will not regrow to an extent which will require a surgery again. And you can see that this is almost a 90-95% removal of the tonsil tissue in a 2.5-year-old child. Thank you for watching intracapsular tonsillectomy.